BW Radio News Time, 12 noon. I'm Nick Gosnell. On the phone with us this afternoon is Reno County Health Department Director Nick Baldetti, because he just sent out a release in the last 15 minutes or so, and I wanted to talk to him a little bit about that. Good afternoon, Nick.
Good afternoon, Nick.
Okay, so let's talk about this. Several more cases of COVID-19 in the county. What are the specifics here?
Yeah, so we are currently up to 10 active cases over the weekend, starting on Friday evening and into yesterday. We registered 9 new cases, and generally speaking, all are unknown sources of exposure outside of one of those cases. So 8 looks like, at this point in time in the investigation, indicative of some community spread. So we're actively engaged in investigation and contacting all the contacts associated with these cases, but a little bit different than previous weeks in terms of the cases that we've registered.
So really, would you consider this, I guess, a spike in cases because of the fact that there isn't any sort of common thread here, or are you hesitating to use that word?
I think I'm hesitating to use the terminology of a spike in cases. I think if we see activity next week or through the course of this week that is familiar to just increasing case exposure, case with unknown exposures, then I might be more applicable to use that kind of language. The other piece of this, too, is obviously continuing to monitor the activity in Sedgwick County, especially within the hospitals as well as our local hospital. And the activity presenting itself at our hospital is there is none. And that, as of this morning, with a census of 75, they have one individual who they've tested potentially for COVID with no COVID-19 related hospitalizations. However, there seems to be activity in Sedgwick County related to COVID-19 and a high increase in hospitalizations and activity there. So I'm continuing to reach out to Sedgwick County, monitor that appropriately, obviously, because we share a jurisdictional boundary, and Wichita is a short 45 minutes away down 96. But generally speaking, no, I wouldn't define this as a significant spike yet.
Okay, that said, then are you still watching, because we've talked about this before, the difference between case count, which just simply means people that have the virus, doesn't even necessarily mean they're sick. There were a bunch of cases in McPherson County where they were asymptomatic but tested positive. I don't know how many of those may be this way in Reno County with this particular set, but the idea being that you're looking at hospitalizations as an important metric here too, not just positive tests.
Yeah, not just positive tests. Again, it's got to be in collaboration and consultation with the hospital system, the healthcare system, the amount of the amount of traffic that Prairie Star and Hutchinson Clinic are seeing in terms of demand of testing. And right now, those indicators in terms of the private clinic at Hutch Clinic, Prairie Star as a community health center, and then obviously the hospitalizations, still relatively stable. So just looking at the case count in totality going up without those metrics moving as well isn't near as concerning as if we were seeing additional upward trending in those metrics.
So, to use the weather analogy that we've used so often before, would you consider this a watch for your office or a warning?
I would say we're still in watch right now.
Fair enough. We're talking to Nick Baldetti. He is the Reno County Health Department Director. Thanks so much for your time, Nick, and I know you've got other folks to talk to this afternoon as well.
Yep, not a problem, Nick. Thanks.
You bet. You're listening to KWBW Hutchinson. More news next.